Hi, so I was just wondering if you could tell me what self-care skills you use in the professional practice.
Yeah, so a self care skill that I practice daily is changing negative thoughts into positive thoughts. I find by incorporating this technique with my clients, as well as on a day to day basis, I remain positive, uplifted, and am able to resolve arising conflicts in a positive manner. This technique allows me to be forgiving and patient, which I believe assists in developing a good relationship and communication skills with clients. Being assertive is another self-care skill I value, as it supports to maintain awareness and boundaries within the clinic. Assertiveness also supports core communication skills, which encourages the clients to express themselves efficiently and forms respect within the clinic. By being assertive, I am able to monitor my own self-care strategies and can learn and grow from my successes and mistakes.
Very good. And what does mindfulness mean to you? What skills do you use to support mindfulness?
Mindfulness to me indicates that focus and attention is in the present, grasping complete awareness of each and every moment that unfolds. I guess this is opposed to being lost in thoughts, opinions, or judgments, but rather value the time of the essence, whether that be good or bad. I practice mindfulness breathing and meditation routinely every morning. I find this really encourages mindful observation, awareness, listening, and appreciation for every day. By practicing mindfulness, I am able to gain therapeutic presence with my clients, which allows me to hear more of what the patient is expressing and have greater access to my own learned knowledge and experience. A small self-reminder or aware breath is a strategy I use to help me return to the present moments when my attention has been shifted elsewhere. Prior to a session or in between sessions with patients, I take time to clear any personal issues, needs, concerns, or judgments, so there's room inside to take inside the depths of the patient's experience.
And how do you practice self-awareness, and do you maintain this as an ongoing process?
I practice self-awareness through mindfulness and self-reflection in order to continue personal and professional development. I find self-reflection allows me to gain a deeper understanding by channeling into how I think, feel, and act. This assists me to improve my learning practices and develop meaningful relationships. I find being aware of my abilities through self-reflection and being self-aware assists me to overcome conflicts and difficult situations in clinical practice. I find self-awareness is necessary for building therapeutic relationships with clients, as it encourages the client to share and engage with the practitioner. To ensure I practice self-awareness each day, I set aside time to reflect on the positives and negatives that have occurred throughout the day and write them down. This not only maintains my focus on self-awareness, but it also helps to clear my mind and help me recognize where my thoughts and emotions are leading me and whether I need to make any necessary changes in order to be on the right track.
Amazing. And can you identify any personal values, strengths, qualities, or any areas of potential development and growth?
Yes, so I think a personal strength that I value is my ability to set and achieve goals, whether that be personal or professional. I find by always having goals to focus towards strives me to be motivated, gain a sense of achievement, and create influence over my own life and decisions. Having my own personal goals allows me to also help clients with how they can be managed and can be accomplished successfully. A well-balanced life is a factor that I value highly, as it keeps me happy, energized, and healthy. Acknowledging that it can be imperfect and change daily depending on my schedule, I do try my best to maintain the balance by setting aside time for activities as well as downtime. By reflecting regularly on my life balance, I'm able to identify areas in which I need to work on or develop any personal growth. I find balance is a key factor to maintain equilibrium and is a concept to practice myself as well to teach the clients.
Oh, amazing. And what do you think therapeutic relationships, why do you think a therapeutic relationship is important in professional practice?
Therapeutic relationship creates a safe environment where the practitioner is caring, supportive, and non-judgmental, allowing the client to be comfortable and welcome. This enhances the engagement, and communication between the client and patient, resulting in successful treatment outcomes. A personal connection between the clientician and the client is established, allowing the client to be felt heard, valued, and understood. Skills that I use to enhance this relationship are assertiveness, listening to the patient, and displaying empathy. Using interpersonal skills develops warmth, friendliness, genuine interest, and the wish to facilitate and support the client.
Amazing. Thank you for your time.